And once again, welcome back. We are here with experts from SIU Center for Family Medicine to answer your questions about the coronavirus pandemic. You can send in your questions via our WGEM Facebook page or through our email at news@wgem.com. Let's go back to our questions now. Renee Terrell sent this question into our Facebook page. She asked, do you think some smaller towns may be ignoring possible infected people because they haven't traveled or knowingly been around an infected person? Dr. Dixon?
I really haven't seen that, and I think it's because just about everybody understands how connected we are nowadays. Even if you come from a small town, and I grew up in a small town, but folks from that small town are still traveling to the bigger towns for employment, for groceries, for those necessities, and I think folks understand that, and so we really haven't picked up on that. I'm from a small town. This isn't affecting me.
All right. What are some of the signs of a mental health issue that I can be looking for in seniors who are more isolated than ever? And what can I do to help? Stacy?
Well, some signs to look for would be some signs of depression. I know that all of the things I tell my patients to usually do, they can't do now. So go out and be more social, get connected, go down to dinner. They can't do those things. In fact, I had a conversation with someone today and she laughed at me because now she can't do those things. So she is trying to be this person helpful in delivering meals to people that at her where she lives, and she's doing some coloring and some inside things and trying to stay busy that way and keep her mind occupied that way. But it is hard. It's very hard. So some symptoms might be feeling more down, feeling like you want to hurt yourself, crying more, being hopeless, helpless, appetite changes. Those are depression signs. There could be some anxiety as well.
Stacy, a follow-up to that. What about for kids or other adults who are at home, of course, shut in right now and in their home and they can't get outside? What about those adults and youngsters?
What to look for?
Yes.
The same kind of symptoms. I listed off the depression symptoms, and also I think the kids can still go outside. They just can't be around large groups of people. And with the nice days that are coming up, it's important to remember that you can still go outside a little bit because they are feeling really cooped up inside right now. But keeping busy, even though they're socially to themselves, you can still connect like through the FaceTime and that kind of thing, and still connect with your friends. I know some of the kids are having like teachers read stories to them online to stay connected that way. I think that's really important, to do everything you can to stay socially connected even though you can't be in
All
person.
right, Skip Barton sent in a question through our Facebook page. What is the treatment if in the hospital, and what is the best over-the-counter medicine to use? Is there anything we can take now to help prevent getting the virus? Doctor?
So I'm going to do that question in reverse. So the first part of the question, or the last part of the question was, what can we take to prevent getting the virus? There really isn't any evidence that any supplements really help. You know, you see a little bit of stuff out there about zinc, vitamin C. I think that as long as you're taking it in reasonable and safe doses, it's fine to try that. Let your doctor know that you're doing those things. But the way to prevent this is to wash your hands and use your hand sanitizer and stay away from big groups and just take care of yourself.